Uh, Good evening. This is the 12 lead acquisition competency evaluation station. And we're going to run through assessing competency for the acquisition of a 12 lead. This is an isolated skill. We don't have to be worried about the continuum of patient care. We're simply evaluating the student's competency on acquiring a 12 lead ECG. So we have a LifePak 15 monitor. Jay is going to walk us through proper lead placement and acquisition of a 12 lead. Okay. I am going to ask the student to verbalize out loud as he's performing the skill. So I, as the evaluator, can make sure he's properly performing the skill.
Okay, so first thing first, BSI scene safety. I'm going to approach the patient, explain to him what I'm doing. Understand he's been having chest discomfort, so we're going to do a 12 lead ECG. I'm going to tell him I'm going to bare his chest, look his chest over, make sure there's no burn areas, no skin missing, no extra hair, no dirt, which it all looks good. Then we're going to apply the leads, and the first we're going to do the limb leads. I'm going to put the right arm, left leg, there, left arm, there. And then the first one we're going to do is V1 as soon as I find it. V1 goes to the fourth intercostal space. A little bit. Fourth intercostal space to the right of the sternum. V2 is going to go to the fourth intercostal space to the left of the sternum. Then the next one you'd place would be V4, and that is going to go to the fifth intercostal space over. And then V3
And
goes
what-
on a straight line between
What
V3
anatomical position is that lead 4 in?
the mid-clavicular
Okay.
line.
Good.
And then V5 is going to go to the anterior axillary line, even with V4. And then V6 is going to go, that's my right leg. V6 is going to go to the mid-axillary line, even with V4 and V5. And then I would have the patient try and remain still, breathe normally, and acquire the 12 lead.
Is it important to identify the patient on your machine?
It is.
And why is that?
So if you have to transmit the 12 lead to the receiving hospital, they know that it's his 12 lead.
Okay, excellent. My only concern about your placement would be where you elected to put your limb leads. Your precordial leads are appropriately placed, but by the book placement would encourage limb leads to be actually on the limbs
Okay.
versus on the torso itself.
Okay.
Outside of that, can you talk to me about lead placement prep? I know you touched about.
Okay, if the site's dirty, you can clean it with alcohol, then you have to wait for it to dry. Then you would apply the leads. If you got too much hair, you can shave the hair to apply the leads. You don't want to put it over any burn areas or anything, or any where there's skin damage, any medication patches. Don't want to put it on top of a implanted defibrillator or pacemaker.
Excellent. Very good, Jay.
If it's an inferior wall, you can always move V3 over the other side to check the right ventricle.
Okay. Okay, Jay, I want to walk you through a special situation. In your female patients, can you walk me through how you would properly place your precordial leads when you can't accurately place your leads on the fifth intercostal space due to breast tissue?
All right. So you'd have to lift up the breast using the back of your hand. Then you would place the leads at the crease of the breast and the wall and stuff, and then you just in the same place as under the breast.
Okay. So ideally, you want to be as close to the anatomical intercostal space
Yes.
as
Yes.
possible. But understand that breast tissue does not conduct electricity and can alter the 12 lead.